Let's now also create one more plot that represent the age and the maximum heart rate, and how are they related to the presence or absence of the heart disease. We'll start first by defining the PLT that we're gonna use. Let's set the fig size to 10 and 6. Let's add some comments to this. So set the plot size. We're gonna use some scatter plots here functionalities. So let's use that. Scatter. We'll use our data frame to use the age specifically from the data frame. Equal to 1. And also we are gonna need the, if you remember the variable from the hard disk latch, also from the hard, with its correlation with the equal to 1. Let's set that color to equal to so let's remind ourselves for what this code was for. So as we said, we'll use the plot the age value and the and max heart rate plus color. So this one will be used for the positive value. Let's identify this since it's equal to 1 here. Max heart rate, positive cases, equal to 1. Now let's also do the same thing, but for the negative examples. So PLT, scatter again, and we'll use the same data frame, f.age by the data frame target. is equal to 0. The same thing goes to the if latch uh, from the data frame target is equal to 0. We'll set that color to be, let's say, light blue. So, light blue. Yeah, let's add max heart rate scalar with negative cases where there were no heart disease were detected. Now let's add some, simple PLT title. Let's call it as heart disease and function of age or in relation, let's say, age and max heart rate. Let's close that. Setting the plot title. What else do we have? Also, let's put some on the x-axis. Let's put some labels. So plt dot label equal to the age here we can say set label for then let's set it also for y label. That gonna be the max heart rate. How about adding some legend? Okay. So here, let's put it as disease and no disease. Now to add labels to groups. Finally, let's show our plot. Not to. Hopefully, we haven't made any mistake. So let's see that now. Amazing. So as you could see, the we have made some scatter plot to present the heart disease in relation with the age and the max heart rate. As you could see that there are some salmon colored points where the heart disease's target is one, where there's these are the salmon points where are the the heart disease cases were positive, or let's say the patient has a heart disease, compared to the light blue here where the patient has no heart disease. So to explain this, so the x-axis here represent the age, ranging from younger individuals to older individuals. As you could see here is the age starts from 30, 40, 50, 60, and 70, while on the y-axis it present the max heart rate. As you could see, some patient has, the maximum heart rate here achieved. Typically, higher is more physically fit individuals, and lower an individual with heart issues. Let's discuss some of the key observations that we have find from this plot. As you could see that people who have heart disease, which is dotted on the Solomon points, tend to be more spread across, different age groups. As you could see that it's not only spotted in only a certain age between 60 to 70 or 50 to 60. It's scattered between different age groups with, mm, like, to be honest, there is no clear cluster. However, you may notice also there is a significant percent of individual with heart across different ages, So we have more than 70, between 60 and 70, 40, and, you might notice that from 50 to 60, it has maybe the higher proportion on, or from 40 to 50, you know. While on the other hand, you can find that people who does not have any heart disease, which is on the light blue points, also it's scattered, you know, in different ages, in different group of ages. Also, individuals, with higher maximum heart rate, since physically fit people typically achieve higher, higher heart rates during exercises, for example. So the pattern, maybe you weren't able to, predict in case if there is a trend or pattern, but you might, notice that the scatter plot could reveal, overlapping regions where both groups, heart disease and no heart disease, are found. This suggests that the age and the maximum heart rate are not fully sufficient to distinguish whether someone has heart disease, as there might be a lot of overlap. Also, a common trend that I've noticed that the older individual tend to have lower maximum heart rates, you know, compared to these, from 50 to 60, to 70, tend to have maybe lower heart rates due to the maybe reduce of physical fitness or, heart related issue. So you may see that the heart disease group, which is the people who is infected with heart disease on the Solomon points, uh, leaning more toward the lower values of maximum heart rate, especially the older, individual. Also, on the other hand, people without heart disease, which is in the light blue, may show a wider distribution in terms of age, but generally they might be found across ranges of higher, heart rate, such maybe suggesting better health or physical fitnesses. You may also observe that as the people age, their maximum heart rate decreases, which is natural with aging. Aging older individual with heart disease may show a lower heart rates, while younger individuals, since they are more into fitness with heart disease, may still achieve relatively higher heart rates. It's important to note that the age alone is not clear determinant for heart disease. Other factors like maybe lifestyle or medical history and physical fitness also contribute. So, what can we conclude from this, visualization? Heart disease is not perfectly, uh, let's say, correlated with age and maximum heart rate, and there is an overlap, meaning that these two features alone, age and maximum heart rate, may not be enough to predict the presence of a heart disease accurately. Maybe we need to look for other factors which is not showing on this plot. You may, try to plot it from your side as the chest pain, if you remember, these variable which is very highly correlated with the target variable, such as also the cholesterol level, blood pressure, exercise habits, which we might not have in our data set, or genetic factors might play, crucial role in determining the heart rate disease risk. You might, involve adding more features to the plot, performing more advanced statistical analysis to understand better which factors contribute most to the heart disease. So the scatter plot is useful, to start point as a starting point to visually inspect how age and maximum heart rate relate to the heart disease. However, a more comprehensive model using multiple features would likely uh, give you better predictive accuracy for heart disease. And visualizing such correlation, in our case, we use the age and maximum heart rate and how they contribute to the positive and negative cases. Visualizing the correlation like this one guide this next step analysis, including selecting features and designing machine learning model. So stay tuned.